The Human Sciences Research Council will present and host a symposium at the 8th South African TB Conference. Now, the conference is taking place from the 4th to the 7th of June this year at the Durban International Convention Centre. Dr. Mamothe Makgabo, Senior TB Technical Specialist at the Aurum Institute, joins us for more. Doctor, thank you so much for joining us. Welcome. Look, so 2025 is set as a year for crucial milestones in the World Health Organization's TB strategy, as well as the National Development Plan of 2030. Now, how close are we from eradicating TB, you think?
We are not that close, and I think with strides that have been taking place, there's a lot of, interventions that are happening in the country towards that. And post-COVID, there has been a lot of plans for South Africa to try and move towards that. We still have got some gaps in our program, but it's gaps that, with innovation that is happening in the country and with governance and the leadership that we have in the country, I'm positive that we will definitely reach that.
And according to the World Health Organization, South Africa is amongst 30 countries which contribute more than 87% of the global TB burden. Now, in South Africa alone, 148 people still die daily due to tuberculosis. Can we reduce this number and maybe share with us some of the reasons you think South Africa continues to lose so many people to TB daily when it is a treatable disease, Doctor?
Yes, I think that's actually multiple approaches. I think we know that there are some drivers, of TB, and in South Africa, and I mean it's issues of overcrowding that we are seeing in our communities, issues of poverty, issues of infrastructure and housing. So TB is really not. It's a problem that affects multiple sectors. It's not just health that needs to address the issues that we have. And I don't think it's just the medical interventions that would ultimately assist with, eradicating TB in our country. We need to have a multisectoral, approach, and that involves different sectors, your social development, your housing, education, and I think all sectors, and most importantly, our very own communities, because they need to lead the interventions that we are coming up with, scientists and clinicians. Our government is actually, we have good leadership, and they're actually leading, in terms of other interventions within the Department of Health. We have the TB recovery plan, for example, version 3, that is addressing some of the gaps that we have identified in the TB program post-COVID epidemic.
And Doctor, staying with that point of the drivers of TB, as you call it, the fact that half of TB patients in the country are also living with HIV, meaning that any strategy that does not address both the TB as well as HIV pandemics will not actually succeed. So how do we then address the stalemate?
I think the important integration of our services, and it's not really just about HIV, but also about non-communicable diseases that we have, and also addressing issues of nutrition, just to make sure that when our patients come to the facilities, they're being weighed, and, if they require referral, they are being referred. So I think integration of services, within the health sector itself, but also most importantly, having proper referral pathways as well, even outside facilities, to ensure that our patients get a holistic approach.
With technology constantly progressing, Doctor, so what are some of the latest developments in TB preventative therapy in both adults and children that you can share with us or you feel are noteworthy at this stage?
Okay, so that's actually shorter, TB preventative treatment. I mean, we've done well as South Africa. We've moved from 36 months regimen and, to 12 months. And now we're looking really at, approaches that are patient-centered, where patients can actually make a decision. And we're looking at shorter regimens. And, the Aurum Institute is one of the leading organizations in terms of TB preventative therapy. And we are now looking at, 3 months of TB preventative therapy for both adults and children, which we are hoping that it would actually assist our communities to decrease, the TB epidemic. And the other thing also is that, one of the interventions that have come through as well is that initially we were mostly looking at people living with HIV in terms of TB preventative therapy and children under the age of 5. But we've got expansion now in terms of our guidelines to actually include any TB contact above the age of 15 years. And I think that would actually assist cap, the challenges that we with TB, because patients can then get, TB preventative therapy.
And looking at the conference, Doctor, that's upcoming, I mean, what types of outcomes as well as resolutions can we anticipate? I mean, are issues of funding for research likely to be part of these discussions so that it's not just a talk shop? There will be resolutions undertaken there that will also be fully implemented.
Yeah, we're hoping that, I think, TB doesn't just affect, South Africa or Africa, but I mean, it's a global challenge, and we are hoping that, the resources that we have for, for research, for example, would sort of be, increased. And I think we have seen South Africa has been one of the countries where a lot of research has happened. I mean, we are basically leading in terms of a whole lot of interventions, the shorter TB regimen, the shorter DRTB regimens that we have just, launched from about 24 months to 6 months. So, if that's actually a lot of research going on, and probably enough economic resources and budget for TB research, I think we would definitely, it would add a lot of value into where we are going as a country, but also globally.